by all accounts, everywhere in BC, a very successful event. Yesterday, clinics in clinics across the province, 33,277 shots were delivered, which is a significant number, up from previous days, but importantly, and this represents, I think, the effort to assist people in walking in to get their shots and focusing on first doses. 16,505 of those were walk-ins, significantly more, several times more than we usually get. The rest were appointments. That more than 80% of the 20,000 doses set aside for walk-ins were used, which we were very happy with. And of the walk-ins, 37.6%, or 6,130, were first doses. This, combined with the first doses that were done by appointment, made it one of the most significant days since really before Canada Day, our most significant day for first doses in some time. So it was a very good day, and for those of us, for Provincial Health Officer and Health Minister in a pandemic, yesterday was a pretty good day, at least as good as Thanksgiving in any event, Walk-in Wednesday. And we were excited to see around the province the effect of that, and you see that both in the numbers and in the response, especially amongst young people in many regions. In Fraser Health, they delivered 2,100 more doses than they had the day before, and heard about the convenience people had from being able to walk in to get their appointments and get their first shots in particular. Clinics in North Vancouver and Whistler were much busier than normal, while Squamish saw a great uptake in walk-ins. Interior Health delivered more vaccines yesterday to walk-ins than their regular scheduled appointments, and it was a very successful day and an important day in Interior Health. And on Vancouver Island, clinics in Comox, Cowichan, and Alberni saw a great uptick for walk-ins in people under 30 years of age. Yesterday was, therefore, a success, but there's obviously more work to do. As of today, we've done, in terms of vaccinations over the age of 18 in adults, 82.6% of adults are vaccinated, 70.6% have received both doses of a COVID-19 vaccine. Over the age of 12, those numbers are 81.7% and 68.4%. That's 6,965,062 doses delivered by the vaccination efforts in BC, by Vax for BC in BC, since we began our vaccination campaign in December. And so I encourage people who didn't get vaccinated yesterday or on previous days or need their second dose to do it today. They can register and book vaccine appointments. That's the best option to secure your dose. But for first doses, all of our clinics offer the possibility of walking in whenever they are open in BC, making getting vaccinated in BC easier than ever before. Today, for example, in Vancouver Coastal Health, they're at Kitts Beach between 12 p.m. now and 6 p.m. giving doses there. In Fraser Health at the BC Ferry Terminal in Delta, along in our work that we're doing with TransLink. On August 7th, we'll be in Surrey at the Fiji Islamic Center. Today, there's a special vaccine appointments at the Killarney Community Centre. Obviously, we're continuing to do with our work with the Downtown Business Association in Kelowna. We're doing the ongoing drop-in appointments at the Kelowna Yacht Club this afternoon. I encourage everybody in Kelowna who's not been vaccinated to go there today as well. We're at the Totem Mall in Fort St. John this afternoon, available for drop-in appointments there, and in Fort Nelson today, all through this afternoon to get your appointments. In fact, all over BC. The message is that the message from the data, the message from what we're seeing, is that now is the time, if you have not received your first dose or you're able to get your second dose, you're eligible to get your second dose, now is the time to book your appointment or drop in to one of our centres around British Columbia. You can go to our website or just Google Vax for BC and you can find the place to go and go. Yesterday was a successful day. I want to thank everyone, all of our healthcare teams across BC, all of our community partners who are part of this, all of the people working and volunteering at our vaccination centres, and all of you, people in BC, for continuing to get vaccinated at rates really as high as anywhere else in the world. This is the path forward. and we have to continue to press and push every single day. Today, if you haven't been vaccinated, is the best day to get vaccinated, and we need to do it. The effort yesterday will continue to be repeated day after day as we find different opportunities to reach people and give them the opportunity to be vaccinated. But there is an opportunity today. It's important to do, and as we see significantly cases amongst unvaccinated people in our province, the need to get vaccinated is stronger and stronger every day. And with that, I'm honored to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. And I am just going to echo the Minister's comments in thanking each and every one of the thousands of people who chose to be vaccinated yesterday. You're doing your part for all of us to get through this pandemic. I'd also like to thank the many healthcare workers, the vaccination clinic staff, and countless others who worked all across this province to make yesterday the success it was. And I heard many stories. I heard stories from people who were concerned about going because they had concerns about getting needles. They were afraid that it was going to be too loud and noisy. And they were all positive stories about how our team was able to answer their questions, how they were able to get the vaccine easily and quickly and calmly, and people who needed to lie down to get their shot were able to do that too. And I just want to reassure everybody, if you have concerns, if you have questions, drop into the clinic. You can talk to our immunizers who've now had the experience of immunizing millions of people with this vaccines that we have available here in BC. And I want to reassure people again that we have been following all of the data on safety and effectiveness, and we can be confident that these vaccines are saving lives and making a difference. As we've been saying for many months, it's thanks to vaccines that we've been able to safely enjoy so much of what we have so far in this summer, and of course, to be able to see each other again. Even though Walk-in Wednesday has finished, our work to offer vaccines to every person in BC over the age of 12 will continue. And in the weeks and months ahead, there will continue to be quick and easy ways for you to access your vaccine across the province. So I encourage people to talk to those who've been immunized, to talk with their family and friends, to talk with your faith leaders about the importance and how you can get your vaccine. As we look forward to fall, though, we all need to be mindful that this virus is not gone. And we've seen that with the increase in cases that we've seen in the last few days and few weeks, particularly in the central Okanagan, where we see again that this virus can take off easily in people who are not protected. It's mostly young people, many who have not yet had the opportunity, there's many opportunities to be immunized. But now is your chance, and particularly as we head back to school, back to university come September, it's going to be more and more important for all of us to be protected so that we can manage this pandemic and move on with our lives. So now is the time. If you're a healthcare worker, if you're a student, if you work in the hospitality industry, we know how challenging it has been for you, and we have seen that this virus can transmit very easily in those high contact environments that you're in. Protect yourself and protect those around you, and that is how we are going to get through this pandemic. I do want to say that we are right now experiencing a surge, as you know, of cases, primarily in younger people between the ages of 20 and 40, and 95% across the province of people who are infected right now are unimmunized, or people who have not yet had their second dose. So that is important for us to recognize right now. That's the message that we have for you today, is that you are at risk, and you spread it to the people who are closest to you. We know as well in the interior, for example, in ICU right now, all of the people with severe illness in ICU are people who have not yet been vaccinated. And that reflects the fact that this virus can transmit even to some people who are partially vaccinated, who are older, who are more likely to have severe disease, or people that are part of your family or friends who may have underlying illness that leads them to be more at risk. We can't take those chances. Now's the time. Go in, get your shot, and thank you for all of you who have done your duty, your best for us to make us, help us get through this pandemic together. Thank you very much, and we're happy to take questions.